Good afternoon, my name is Yvonne Twigger, and today my group and I will be presenting how information technology is changing healthcare. The topics that we will cover is history of healthcare information technology, past, present, and future, health IT legislation, EMR and EHR implications and functionality, cost effects, implementation, training and maintenance, security issues, and gadgets. Let's start off with healthcare IT. In the 1950s and 1960s, this is the infancy of computers. The healthcare drivers right now are Medicare and Medicaid, mostly government-based, shared hospital accounting systems. In the 1970s, the healthcare drivers in this decade are used in hospital communications, admission, discharge, transfers, as well as order communications and bed control. There also expanded financial and admin systems, results reviews, and selected clinical department automation such as lab, medical records, and pharmacy. In the 1980s, the healthcare drivers in this decade are mostly diagnostic-related groups. There is also some use in integrated financial and clinical systems, albeit limited, as well as departmental imaging, limited systems due to storage. In the 1990s, we see access to distributed computers. There's cheaper hardware and storage capabilities. The healthcare drivers in this decade are competition and consolidation, integrated hospital and provider and managed care, as well as expanded clinical department solutions and emergence of integrated EMR capabilities. The 2000s, we really see computers getting faster, smaller, and cheaper. Everything's becoming more mobile and speed has increased. We see emerging cloud computing. The healthcare drivers in this decade are more integration and beginning of outcome-based reimbursements, broad operational department systems and EMR integration, as well as emerging data warehousing and analytical solutions. And also we see legislation being passed. The future in IT. Basically, we're going to be seeing a lot more digital diagnostics where people don't have to go see their doctors. They will get diagnosed via telecommuting or through the video. There's also going to be ultra-fast scans, wearables, which we're seeing some of that now with fitness trackers and smartwatches, health informatics, managing the data, using the data, and also the University of Michigan in 2014 did a study where half of the US hospitals use some type of electronic record keeping, but only 6% meet all federal mandates, so there's obviously a lot of room for improvement. Digital therapies, this is where people get discharged from the hospitals and they don't have to go into a therapy facility if they live too far. They can have softwares that they use and input their information, such as to-do lists for patients and track their diets and exercise. Obviously, this is only as good as the information that they input. We're also going to see hackathons. This is where a lot of smart people get into a room and try to solve a problem, and this is going to be big in the healthcare industry, as well as gadgets, which Magna will talk about in detail. We're moving on to healthcare IT legislation. I'm going to cover HITECH Act, HIPAA, and PPACA. What does the HITECH Act actually stand for? It's Health Information Technology for Economic Health. What does it do? It provides healthcare services with the authority to establish programs to improve healthcare quality, safety, and efficiency through the promotion of health IT, including health records and private and secure electronic health information exchange. Legislation was passed in 2009 and encouraged adoption of the electronic health records. In 2011, healthcare providers would be offered financial incentives for demonstrating meaningful use. So it's not only good enough to have health records, you also have to demonstrate meaningful use for reimbursements. This would be rolled out, the rollout of the meaningful use will happen in 3 stages. And providers will show 2 years in the stage before moving on to the next one. So this is not something that will happen overnight. Adoption of stage 2 has been slow. Therefore, 2014, the Center for Medical and Medicaid Services announced it will put stage 3 off until 2017. Stage 1 has a minimum bar of 25 criteria, 15 core, and 10 menu requirements. And you can read those on your own. I don't have the time to cover that. Stage 2 reinforces Stage 1 requirements and introduces new ones such as demonstrating the ability to exchange key clinical information between providers of care and patient-authorized entities electronically. And Stage 3 is still in development. The authors believe that they will be able to roll something out by spring 2015. We also have meaningful use attestation, so compliance and governance paperwork to prove they have completed the stages required and are eligible for reimbursements and to move on to the next stage. Organizations that do not attest on time will incur penalties. Some organizations have decided to opt out of Stage 2 and 3 because of lack of progress and lack of budget. They will incur penalties for that. Now we're going to talk about HIPAA. What does it stand for? Health Insurance Portability and Accountability Act. Congress passed this in 1996, and it's the act to ensure a person's right to buy health insurance after losing a job, establishing standards of EMRs, and protecting the privacy of patients' health information. It defines boundaries of use disclosure of health records, and it also mandates industry-wide standards for healthcare information on electronic billing and other processes. Individuals are required to request and have access to health records in writing. The HITECH and HIPAA are separate and unrelated laws, but they do reinforce each other. PPACA stands for Patient Protection and Affordable Care Act. This is also referred to as Affordable Care Act and generally known as the Obamacare. Legislation has created and passed in Congress in 2010. Legislation includes a long list of health-related provisions that began taking effect in 2010 and will continue to be rolled out over the next 4 years. But as we know now, that is still being rolled out and still being tweaked. The key provisions are intended to extend coverage to millions of uninsured Americans, to improve measures that will lower healthcare costs and improve system efficiency, and to eliminate industry practices that include denial of coverage due to pre-existing conditions. This is also where the kids can stay on their parents' insurance until age 26. Thank you. I'm going to turn it over to Kayleen.
Hi, my name is Kayleen, and I'll be talking about EMR functionalities.
So EMR and EHR, these two terms are actually used synonymously. However, they do mean different things. An electronic medical record, or EMR, is actually a digital version of paper charts. It does keep track of patient status, so blood pressure and vaccinations would be in that system, and it can track that data over time. However, the EMR information isn't easily transferable outside of that organization. So if the physician office needs to send information out to a hospital, it's harder to get that to go across since everyone uses a bunch of different EMR systems. An EHR, electronic health record, is actually more comprehensive. It can reach beyond the original healthcare organization and share that medical info with stakeholders and patients. And it includes more comprehensive health information like tests, the results from tests, allergy information, and it can include patient access and makes it easier for the primary care physician to follow up. In a physician's office, EMRs are very helpful because they can help guide the patient visits. So they know what to ask and check up on for that specific patient. And it is easy for the doctor to review the information as well as update any information such as medication or allergies and shots. It can help reduce medical errors, and it also provides templates for orders or consult letters or things like that so the doctor can generate those documents easily. However, there are some drawbacks for EMRs in physician offices. It can provide or cause new or more work for clinicians, and that would change the workflow, which can be halting and expensive to establish that new system. And also choosing the EMR and the cost. There are dozens of different EMR systems to choose from with different things that you can do on that EMR. So it's very hard for physician offices to choose what to use. And there are also new types of errors, data entry errors and things like that. And turnover. So if you have to train new people constantly, it makes it very difficult with that EMR. In hospital systems, they use the EHR, and it's a good way to avoid dangerous mistakes because you do have that allergy information right there in front of you. You can immediately transfer patient information between hospitals and organizations within that system. And it helps to decrease storage space. So you no longer have that back room where you saved all the charts, and now you can have it all on a server or within that system. These EHRs can track tests and medication on a greater level and include more patients and more hospitals. And it also helps schedule patient visits and procedures. So the main workflow before the EHR was implemented had 4 parts. So they would collect the chart, they would review that chart, meet with patients, and then write their summary. And then later when that EHR was implemented, it added more steps for the collect chart part. So that portion was split into log into EHR, review information, review message center, sign verbal and telephone orders. And this is all just that first step of collecting charts. And then after that, they can continue with their workflow. Some of the common complaints with EMRs and EHRs is that there's too much downtime. If the system is down for maintenance or for any other unforeseeable reason, we do have to have procedures in place for the clinicians to continue their practice and provide quality care. And that means you have to have certain people trained in doing it, so that causes issues in the care for patients. Sometimes there's not enough access to IT technicians to help with issues if there are any technical issues. There are security concerns for hackers and losing information. And even if that EMR, EHR helps with quality, maybe less errors or ease in decision making, it's very hard to quantify and measure. So an administrator looking at your numbers for the month, it would be really hard to measure that quality improvement from that EHR. It's also a big investment and can cost a lot of money. In the United States, the Office of the National Coordinator for Health Information Technology did a survey. In 2001, it showed that only 16% of office-based physicians were actually using an EMR or an EHR, whereas in 2013, 78% started using those kinds of systems. Overall, EHR helps shape healthcare by increasing patient satisfaction. It provides a safer environment and better communication among healthcare providers. And it also unifies healthcare systems to give patients more consistent care. Thank you.
Hi, my name is Diana, and I will be talking about the barriers to IT adaptation. Some of the barriers are cost, integration, training, and reluctance. Cost is the primary barrier. The cost of implementation and maintenance varies between systems and vendor. It can cost tens of thousands of dollars per physicians and even millions for large hospitals. The initial investment is substantial. One of the main questions is, will it save money in the long run? And a few of the ways it can save money is reducing office supplies, like paper, increasing productivity, and the unnecessary need of a medical records clerk, which can save up to $2,000 a month. Integration. New systems must integrate with existing systems for data exchange and with other systems, such as lab and radiology. This can increase cost. Training. Training is important because it helps change the negative perceptions and improves the likelihood of adaptation. It can take a lot of time and a lot of money. It can be time-consuming because the initial training itself takes time, and then follow-ups and ongoing training are required to ensure the success of the systems. Reluctance. Physicians' acceptance of IT is critical. Rejection may be due to lack of understanding about the user benefits and also fear of change. Reluctance may be due a lot to the amount of time implementing systems take. It can take months or even years. Companies have to enter existing patient data, which may be very time-consuming. Organizations are forced to redesign workflow like the exam room and other office since new roles come with new systems. Another reason for reluctance is privacy issues. Misunderstanding about IT may lead to physicians and nurses to believe a decrease in the amount of time connecting with patients. So basically, overcoming reluctance is a major key in IT implementation success.
Hi, my name is Maribel, and I will be going over information technology security. IT security in healthcare. The foundational element of a functioning healthcare environment are information security and patient privacy. Privacy and security are important because it refers to the confidence of a patient's personal health information. A little history of security, IT, in healthcare. Security is a fundamental human theory and has become more challenging to describe and implement in the information age. Another part of IT security is encrypted emails. Email security. Emails are encrypted to protect the content from being read by any. Only the intended recipients are allowed to do so. As a form of major communication, patients, healthcare providers, and staff rely more on email. Encrypted email from intermedia helps reduce the challenges and complexity of managing regulatory compliance and data loss protection. Without messing up the day-to-day workflow, policy-based instructed encryption results and serves healthcare organizations with a simple way to implement encryption. HIPAA compliance requires numerous layers of encryption. 1. Domain-to-domain encryption, which is also known as boundary encryption. Number 2, policy-based encryption. And number 3, user-based encryption. The importance of disaster recovery in healthcare. Disaster recovery is the area of security planning that focuses on protecting an organization from the effect of significant negative events. Natural disaster, equipment failure, and cybersecurity threats are some daily challenges that causes data loss and downtime. Patients' health and lives rely upon system always being up and running, and in just a few minutes of downtime and system not working can affect patient care. That's why a disaster recovery plan is mandated. HIPAA disaster recovery laws. A HIPAA enclosed practice must implement probability plan to promise a non-stop approach to an electronic protected health information, EPHI, in the case of a system breakdown. HIPAA disaster recovery laws contain the operation of EPHI data backup plan in extension to disaster recovery emergency mode operational plans. PHI. What does PHI mean? PHI is protected health information. PHI is a set of national standards that provides individuals with health information privacy rights and helping individuals understand and control how their information is used. PHI lost or stolen. Breaches can occur in many ways. For example, when employees lose unencrypted portable devices, when they send PHI to vendors who post that information online, and by posting personal information on social media. Almost half of the data breaches are results of theft. Since the fall of 2009, more than 400,000 large health breaches affecting at least 500,000 people and more than 50,000 smaller breaches have been reported to the federal government. HIPAA violations. HIPAA violations are expensive. Penalties for noncompliance are based on the level of negligence. IT hackers. Healthcare is a prized possession for criminals looking to steal a lot of personal information. In the last few years, IT security threats have grown at a dangerous rate. Security refers to the confidentiality of medical system data with designated concern for patient records. For example, in one of the biggest HIPAA security breaches reported, hackers accessed a server from a Texas healthcare system, compromising the protected health information of 405,000 individuals.
Hi, I'm Meghna and I would be talking about gadgets. First is IT Bra. It was developed by Circadia Health Innovation, and it detects tiniest circadian temperatures and abnormalities in the breast tissue. With just a monthly wear of 12 hours, it relays highly accurate and highly correlatable clinical diagnosis of breast cancer, in some cases even early diagnosis, even with dense breast tissue. Another one is called Melomind, which is kind of a headband which basically relays EEG using biofeedback loop to reduce stress. It is not yet in the market and has been compared to any standard lab care yet, but it is very similar to the Muse headband, which uses calming exercises that are given to you by your phone through an app. That's the Melomind right there, and the Muse headband, and on the bottom is the Google Glass, which I will be talking about in my next slide. So the Da Vinci surgical system is used in surgeries, and it has a magnified 3D high definition vision system and tiny wristed instruments that bend and rotate far greater than the human wrist. It enables surgeons to operate with enhanced vision, precision, dexterity, and control. The Google Glass, as seen in the previous picture, is now widely used, but Google plans to discontinue it eventually. But a company called Pristine, based out of Austin, Texas, has created plans to sell a customized version of the glass directly to hospitals. It erases Google software and configures the glasses with its own HIPAA-compliant programs. Basically, the glass would update all its files to a Google Cloud, and that can be accessed by anybody, so there are security issues with that. That's the Da Vinci system. Now we go on to another device called Visi Mobile, which basically is like a large wristwatch, and it has wires coming out of it, and it measures vital signs, PO2, and 3 and 5 lead EKGs. It goes to the chest for readings of pulse, respirations, and EKG strips. There's also a wire for the pulse oximeter to measure PO2 from a finger clamp, and the blood pressure is monitored non-invasively by sensors. That's how Visi Mobile looks. Another one which is called the Alive Core, which is an app it's a device that attaches to your iPhone and works with an app. It records health rhythms along with your symptoms, lifestyle activities, and medications, and it is FDA cleared. It immediately detects atrial fibrillations in an ECG and track trends to share with your doctor or anyone else using the mobile app. It is also developed for veterinary use, and it is compatible with the majority of animals. You can see a koala bear having his EKG done by the Alive Core, and the bottom one is the third version of the Alive Core. It just attaches to the back of your phone. Some of the other gadgets that basically are not up for hospital use, but you can purchase them, are, for example, the Entertainer, which is the first one you see on the right, which looks like a waistband and a thing next to it. It basically has a predetermined level at which you have to exercise in order for you to keep watching TV, or it lowers your TV volume or shuts it off. Another one is called the Happy Fork, which basically gives you vibrations when you have exceeded your portion limit per meal. And another one is called the Mimo Baby Monitor. Now the Mimo Baby Monitor, as you can see, the child is wearing it. It basically tracks baby sleep cycles, heart rate, EDM, pulse rate, etc. And you don't have to check on your baby every time, every half an hour in the night. And it can be used to track sudden infant death syndrome. The next one is the June bracelet, which is basically a bracelet that tracks your sun exposure to skin, and it basically relays when your melanin levels go down and or go up, and alerts you in an app. The next one is the LumoLift. I don't have a picture for it, but it's a small chip that you can put on your back, and it basically alerts you whenever your posture is incorrect. The last one is the Oral-B toothbrush, which now comes with an app that tells you whether your brushing habits are okay or not, and it tells you where you can make improvements. Thank you, that is it.